A breast reduction is primarily an operation to reduce the size of the breasts, to make them smaller. As well as that, you're also repositioning the nipples so that they are more forward pointing, because that's one of the issues with breasts that are quite big. They tend to have drooped, and therefore things tend to point downwards. They also tend to have lost some fullness in the upper part of the breast, the upper pole. And so a breast reduction not only makes the breasts smaller, it also lifts them up to give you a bit more fullness in the upper pole. To know if you're a good candidate for a breast reduction procedure, first of all, you've got to be fit overall and pass the tests that the anaesthetist will need you to get through, because this is an operation done with you fully asleep under a general anaesthetic. You need to be of a suitable weight, and we tend to specify a body mass index of 28 or below, thereabouts, because we know that you can get more problems with recovery and healing after surgery if your BMI is higher than that. You need to basically want to go through this procedure, because it isn't without its costs. So you need to understand what the procedure actually involves. If you were to think of the breast as being like a pudding with a cherry on top, we're taking a slice out of it and then folding it together to make a smaller pudding. The cherry on top, though, which is the nipple, has to remain attached to its blood supply, which comes from the plate underneath. So you have to keep a stalk attached, and that's the careful part of a breast reduction. So effectively what you're doing is taking a wedge out, keeping this attachment from bottom to top, folding it together, and making a smaller breast. A typical candidate who is asking for a breast reduction is quite often complaining not only about the size of their breasts being an inconvenience, and the size is an inconvenience because finding clothing to fit is difficult. Finding confidence whilst wearing slightly tighter fitting clothing is an issue, and so therefore people tend to hide them by wearing looser clothing. The kind of problems that women also report, apart from just the fact that they've got larger breasts, are the problems that go with the weight of larger breasts, and that's shoulder strap pain from the bras, neck ache, backache, shoulder ache, and getting sores because of bra straps being pulled down. Exercising can be an issue as well because of this extra weight they're having to carry all the time. Swimming can be particularly troublesome because the breasts, which are in a large part made up of fat, can actually act as flotation devices, making swimming difficult. Running can be really uncomfortable because of the weight. And so therefore we do get people coming in saying, if only I could lose the bulk of this weight on my breasts, it would allow me to then exercise more and then get into shape better overall. A breast reduction is always done under general anaesthetic in my practice. It's done as a day case. You arrive about an hour before you're due to start your procedure, having been told when to stop eating and drinking. The actual surgery takes about 2.5 to 3 hours of being asleep, and then you tend to go home about 2 hours after waking up. So generally speaking, you're in the hospital for most of the day. You're actually asleep having surgery for about 3 hours of that day, which may not seem like a very long time, but it's a medium length procedure in terms of compared to other plastic surgical operations that I do. After surgery, you will wake up from your general anaesthetic wearing a bra, which is for support. You'll have sticky tape over the incision lines that have been stitched together. It's all dissolving stitches, so there are no stitches to be removed eventually. The sticky tape will go round the nipple, underneath and across typically. That's a full anchor pattern breast reduction. When you wake up, you might be a little bit uncomfortable. Your pec muscles can ache because they do get a bit bruised with this surgery quite often. So moving your arms might be a little bit achy, but it's important to keep them moving, otherwise they can stiffen up. The bra will help a lot with pain relief, and you'll go home wearing that bra, with somebody taking you home and making sure you're okay overnight. So you'll need a partner to help you, look after you for the first night for sure. You'll be able to shower the next day. You take off the bra, but you keep the sticky tape in place and have a shower as normal. Again, probably with somebody just making sure you're okay for the first time. And then after that, you're probably okay to look after yourself independently without doing anything too strenuous. And then you'll come back a week after surgery to see our nurse, who will take the bra off, check everything is okay, take the sticky tape off, make sure the incision lines are healing okay, make sure the nipple is also healing well with a good blood supply. You'll then probably have the dressing replaced again for a few more days, and then it might be that you take it off yourself or you come back for another check after a week for the nurse to help you do that. And then after that, you're pretty much managing things on your own, slowly getting back to normal activity. In terms of getting back to day-to-day activity, that's probably happened within the first week. You'll be able to look after yourself, cook for yourself, simple things, shower yourself, and spend time alone at home. In terms of getting back to work, 10 to 14 days. Getting back to exercise, that might take a little bit longer, especially for upper body exercise, because your arms can hurt. But you might be able to get back to walking and maybe an exercise bike after, say, 3 weeks or so. By 6 weeks, you're doing pretty much all exercises, and by 3 months, it's as if you've not had surgery. You're kind of back to normal. Like all other surgery, breast reduction does have its own specific risks. The main one is to do with the actual nipple itself. You need a good surgeon who's going to ensure that the blood supply is maintained properly, so that the nipple doesn't run into problems later on. The main risks that we talk about with regards to nipple are the sensation, and do be prepared to lose feeling in your nipples. That's fairly common after breast reduction surgery. Also, do be prepared to consider how you'd feel about not being able to breastfeed after reduction surgery. So quite often women who have breast reduction have thought about it for a while, completed their families, and are now ready to not be able to breastfeed if need be. Getting the size exactly right is something that you need to be prepared to tolerate. I never promise that you will be exactly this cup size or exactly that waist size or chest size. It can vary, and again, surgeons will use their discretion to maintain a good shape and hopefully give you the best result possible that balances not only the reduction in size but also the best shape. If breasts are made too small, they can sometimes look an odd shape, so we try and avoid that. So there is a bit of compromise there. What I would say is that by coming to a place like the Cadogan and having surgery with somebody like myself and with the anaesthetic and nursing team and all the other adjuncts that we have here, those risks will be minimised to the best of our ability.